Welcome back to the Oxytocin Effect. Today we are going to be getting into Caitlyn's birth stories. Today is just going over the twins, so if you want to hear a twin birth story and all about the pregnancy, finding out that there were twins, postpartum, how all of that went, please stick around and we are excited to show you.
But yeah, no, I knew I wanted to be a mom from a young age. And I met my husband in the military, and he was the kind of person who was a lot more like slow to act. Like he didn't want to get married for 5+ years, and he was really resistant to having kids even when I was ready. So honestly, I just pestered him enough, and complained enough, bitched enough. Honestly, if we're using the correct term, I was just complaining all the time, especially because all the people around me were getting pregnant, including my sister, who was not in a position where she wanted to be pregnant or, like could handle having a baby. And here I am, like wanting a baby so badly. I really felt like there was a hole in my heart. Like I felt like there was something missing. And now fast forward, it was 100% that. Because as soon as I had my twins, it literally fixed whatever I was like yearning for. And part of me wondered, like, maybe I think it's children and it's actually something else. But no, I was actually like children that I was like wanting. Well, okay, so I complained a lot and he resisted a lot. And then one day, I think it was because my sister had gotten pregnant. And like I said, it was not a planned pregnancy. It wasn't necessarily a wanted pregnancy. And she was not in a position to really have a baby at that time. And so I was sitting there complaining to him again and being like, I actually want a baby and I can't have one because you are not ready or you don't want a child right now. And in his mind, it was always like, well, it'll be better if we wait. And well, because he had a spinal cord injury back when we were in the military. And it was the same excuse he gave me for why he was postponing getting married too. He's like, I don't want to get down on one knee and, like feel wobbly or like, struggle to walk down the aisle and stuff like that. But I called him out on that for what it was, which was an excuse. I was like, you cannot like postpone your life because of your injury. And he was saying the same thing with kids. Like, I want to be able to throw a baseball or do this and that. And I'm like, you are going to maybe be waiting for way longer than what's reasonable. Maybe we'll miss the chance. So there never is a perfect time to have kids. And I think people don't realize that sometimes is like, you will never be at a stage of your life where you feel like you have enough money, where everything is perfect. Yeah, there's certainly situations where you definitely don't want to bring kids into that situation. But, looking at where we were, like we had enough money, we had enough, going on that we could afford to have kids and that we'd be good parents and they'd, get enough attention from us. So anyways, I was complaining again, this time about my sister being like, I'm happy for the fact that we're going to bring, I'm going to get a niece and all of that. But like, she doesn't even want to be pregnant and I do want to be pregnant. And like, what's going on? Why can't we just do it? And then he was like, okay. After so much fighting, he was finally like, yeah, we can try. And it took me totally off guard. I was not expecting him to change his mind like that. And I did ask him, I was like, what happened? Why did you just all of a sudden be okay with something that you were resisting so hard? And he's like, well, I never want to tell you that I want to do something until I'm 100% sure. So even when I was maybe 95% sure, I made it seem like I wasn't ready at all because I didn't want to get your hopes up or get you excited about something. And so I was 100% sure at that point. And so we started trying, and the very first month after I took my Mirena out and we started trying, we got pregnant. And I remember the way that I didn't know, but I had an inkling that I was pregnant because I had this like crazy, weird, vivid dream. This was before I really knew a whole lot about like pregnancy dreams, but had this crazy, weird, vivid dream where I found out I was pregnant. And yeah, I took a pregnancy test that morning and it was positive. And funny enough, fast forward, when I had another dream during the same pregnancy, in the dream, I had twins. And then like a week later, we found out we had twins. So that was wild. And funny thing, every pregnancy has been that way, where I get a weird pregnancy dream or I get a dream that I find out that I'm pregnant, and that's what tells me that I'm pregnant. I had kind of suspected maybe I was having twins. I do not have twins that run in the family. Everybody asks me that. And my twins are identical, which a lot of people don't realize. Identical twins are not hereditary. It's not something that's passed down in families. We don't know what causes it. And it's as likely to happen to you or me or someone else, regardless of whether or not you have twins that run in your family. And I don't have twins that run in the family, so I had no reason to think that I was going to have twins. But I just had a weird feeling because, one, I had really intense morning sickness. Two, I started showing pretty early, even though I was in very good shape. Like, I was preparing for the Miss California pageant and the Miss United States pageant after I won that. And I had very good abs, I guess you could say. And I was just like in really good shape. And people told me, because you're tall, you have a lot of space in your abdomen, and because, you're really fit right now, you're probably not going to really start showing until, I don't know, I think they said like 20 weeks along or something like that. And here I was at like, I want to say like maybe 11 weeks, 10 or 11 weeks. And I already felt like I had a little pregnancy bump, which I knew was like crazy early to start having a pregnancy bump, especially when it's your first baby, your abs haven't stretched out yet. And yeah, it's like I'm tall, so I have a lot of room. So it didn't make any sense there. And then there was one time too where I listened with a Doppler and I felt like I had heard different heartbeats on different sides of my abdomen. So that was a little strange too. And then another thing too, my very first ultrasound that I had was around 6 weeks, which is like the earliest time you can see any like embryo or anything in there. And it might have even been a little bit before that, maybe like the very beginning of the 6th week, because you couldn't see an embryo, but you could see a yolk sac. And I remember asking the doctor what that was, knowing what it was, because I had worked in OBGYN and I knew what a yolk sac looked like. But I had seen on that ultrasound 2 yolk sacs. And so I asked the doctor, leading into the question that I actually wanted to ask, which is, why are there 2 of them? But my first question was, what is that? and he was like, oh, that's your baby's head. And I was like, no, it's not. I didn't say that, but in my mind, I'm like, that's definitely not a head. Heads aren't fluid filled. They are not white with a black, inside. Like, that's not my baby's head. But I think this is a VA gynecologist, so they didn't see a lot of pregnant women at the VA. So I didn't want to like embarrass them or, be like, no, it's not. So I just like didn't ask. But I did see 2 different yolk sacs on this ultrasound. So that was strange. And so I had some kind of inklings and I kept telling my husband, like, what if it's twins? And then we had a second ultrasound at 8 weeks. And still one baby, or at least that's what they thought. And it wasn't until I was 4 months pregnant, 16 weeks along, that I went in for a third ultrasound. And this was supposed to be sort of like a screening ultrasound to screen for genetic abnormalities. And she brings me in while Matt, my husband, is parking the car, and was like, oh, don't worry, we're going to bring him in, and puts the monitor or the ultrasound probe on my belly. And on the screen, I just see all these limbs, like so many limbs. Like, I'm not super keen on all the ultrasound things. That's not something I have a whole lot of experience with, but I could see at least like 5 limbs. And so I was very worried that my baby had like an extra arm or something. But then I was like, no, this is twins. That's what it is. And she was so silent, and she was just moving it around. And, I'm like looking at her, like waiting for her to tell me that I have twins. And she's like, so, you had an ultrasound, a dating ultrasound. What did your midwife or doctor tell you about that ultrasound? And I was like, that I'm pregnant and having a baby, and like more awkward silence. And then I just looked at her and I was like, it's 2 babies, isn't it? And she's like, yes. Oh my gosh, I can't believe they didn't find this or tell you sooner. Like, this is not the ultrasound we're supposed to be diagnosing this at. And she was like freaking out, and I'm freaking out. And then she's like, oh my gosh, I need to go get your husband, because he wasn't in there to like reveal this information. He was parking the car. So she went and grabbed him, and he walked in and saw me pale as a ghost. He thought that something was wrong, like the baby had passed or something. So he was actually very relieved when I was like, it's 2 seemingly healthy babies. And yeah, it was like the craziest experience. I remember the first thought that I had when she confirmed that it was twins was, I'm going to have a C-section. That was the first thing I thought. And it's a high risk pregnancy and all of that. Like, I was not concerned at all by like 2 college funds or like all the extra diapers or any like those. I actually loved the idea of having twins like after the birth, assuming that they turned out healthy. But I just immediately was flooded with fear and just anxiety about having a C-section, losing one of them, or like having them be hyper premature or just having a problem happen. And so, I wasn't expecting that I would have that reaction, because I had thought about having twins and kind of wanting maybe one day I'd have twins, like hoping maybe that would happen and feeling like I'd be lucky if that happened. But then instead of being excited like I would have thought, yeah, all of it was just like fear. And it did end up being a very high risk pregnancy, but, ultimately ended up being good. And I was in that spot where I knew enough. So here's the thing. I was in the spot where I knew enough about like a normal low risk pregnancy to be able to honestly probably protect and advocate for myself really well. But when you now move the ante or like just shift it a little bit into this like high risk pregnancy area, it put me in a position where I knew enough to where I was anxious and scared. Not enough though to know how to navigate things or to know what to do a lot of the time, which ended up becoming like a theme towards the very end of the pregnancy, because the rest of the pregnancy was chill up until they diagnosed me with something called vasoprevia, which is literally so crazy rare. It happens in 1 out of every 2,500 pregnancies. And it's where there's a blood vessel that runs over top of the cervix on the inside of the uterus. It's a placental like baby blood vessel, right? Like in the placenta. Except what happens is, it usually happens when there's like a placenta that grows over the cervix, like a placenta previa, which is a lot more common, except oftentimes with the vasoprevia, the tissue that protects a lot of those blood vessels ends up sort of kind of degrading away or like, sort of dying a little bit, so that it leaves behind just the blood vessel, because the bottom part of the uterus is not very vascular. So the placenta tissue that protects those blood vessels goes away and leaves behind this vulnerable blood vessel that if you, for example, rupture your bag of water in the right spot, would cause a massive hemorrhage to the baby, and it would result in death within minutes, which is terrifying. So that blood vessel, which is, baby's blood supply, was found, I think, in like past like the 20th week. Maybe it was at my anatomy scan. And the doctor really freaked me out. The same doctor that freaked me out after they found the twins and told me like, by the way, and it's not his fault. It's good that he said this, but I remember him coming in and being like, so you're probably really nervous about this. And, and I was like, oh gosh, well, I guess I should be really nervous about this if that's what you're saying. And he told me like, well, if one twin dies, then the other one is likely to die very shortly after, because they share a placenta and shifting of blood causes the other twin to die and all this stuff. And we could have something called twin-to-twin transfusion that happens down the line, things that hadn't even happened yet. He was kind of warning me about. And then, when they found the vasoprevia, he really freaked me out, because he came in and like held my hand. It was like, I'm going to hold your hand when I say this kind of thing. And explained like, don't go on the internet and search this up after you leave here. It's going to freak you out. And I'm like, oh gosh, you shouldn't have told me. Again, he was definitely doing his best to like, handle a very sticky situation, because that's very scary. And he explained at that point that usually around, what did he say? Like 30 weeks, we put people in the hospital just until they have the baby, or the babies in my case. And that was crazy. So that was what I was anticipating from that point on, is I was going to be, admitted to the hospital. And I was not expecting bed rest at first, but they did end up putting me on bed rest, and I lived in the hospital for a while. I ended up not getting admitted until closer to like 32 weeks. No, I was admitted at 30 weeks. Yeah, I was admitted at 30 weeks, and I actually went to a hospital different than the ones that my twins were ultimately born at. I went to a hospital that was in California. So this was all in like the California Bay Area kind of area. I went to a hospital that was in Sacramento that I had thought that I researched really, really well. And it turned out that it was like a total trick. And people have said that maybe this hospital did it on purpose, because there was like a hospital near Davis, which is near Sacramento. And then there was one in Sacramento, and they both had very similar names. So I went to the one that was actually known for being terrible instead of the one that was known for having really great midwives and really great outcomes and not a high C-section rate and all those things. And so I ended up there, and immediately, yeah, they put me on bed rest. They wanted me to have an IV for the whole time I was there. And I was like, that's insane. Like, I'm supposed to be here because I mean, it was going to be an early delivery date, but I think we were planning for like 36 weeks. So we're talking 6 weeks of having something penetrating my skin into my vein. I'm like, I'm going to get an infection. But it was like, well, we want to be cautious, because if something happens and we have to rush you back for a C-section, I'm like, give me an IO or something if that happens. Like, I don't feel like having an IV in my arm for 6 weeks is something that's good for me. I was like legitimately worried about like getting some sort of infection, because I've never heard of an IV being in that long. But that, plus the bed rest and a bunch of other little red flags, made me feel very uncomfortable there. And I did something that a lot of people probably wouldn't have done at that time, but I was like, I want to leave. And I left against medical advice and drove myself to UCSF, where I worked a lot as a doula. And so I knew that UCSF was a good balance between like listening to their patients, but also like they were legit, they had a really high level NICU and all of that. So I wanted that balance, and I checked myself in there, and I think that was a good decision. And I hung out there, for weeks until my babies were born earlier than expected at 34 weeks instead of 36. And that was because of that thing that doctor warned me about, twin to twin transfusion. My baby A was significantly enough smaller than baby B to diagnose them with essentially twin transfusions, essentially IUGR, intrauterine growth restriction, but for identical twins that share a placenta. And it's because of the placenta. One is just not getting enough. The other one's getting more than the other. And they were worried about, stillbirth or something like that. But I will say, like, the whole experience of being in the hospital and having these complications and considerations, one of the most impactful things was how anxious I was every day. And it was a new conversation that I had to have every day with different providers, like different physicians, different residents were cycling through my room, trying to steer me towards what they wanted, which at this point, they wanted a much earlier due date, a delivery date, than what I was comfortable with. I had done a lot of the reading on this stuff, and the doctor that had diagnosed all of this stuff and had warned me about a lot of different things said 36 weeks was a safe place to land, and this hospital wanted to do 35. And so it was just the difference of 1 week. That was all it was. But to me, it was important. I really wanted them to be as close to term as possible. And so I was like, look, I'm tall, taller people tend to hold pregnancies a little bit better because you have a little bit more room. So like, I'm like, if my cervix isn't shortening, like, I'm not worried that I'm going to go into labor prematurely, because that's what they're worried about, is like, you're going to go into labor early and then the blood vessel is going to break. But they were monitoring contractions, making sure that my uterus was completely docile and not doing anything. So I was trying to advocate for that extra week, and I had to advocate for that every dang day, to different people, and then to the same people that I advocated to 4 days prior. It was every day, because it was new people almost every day. And then I'd see the same person and we'd start the conversation over again. And it was actually breaking me down emotionally. It was exhausting. And it was really a crazy experience, because I felt something that I feel like a lot of my doula clients probably felt. Like, for them, they had low risk pregnancies for the most part, and they were advocating for things that were very, just well-known routine things that like I knew everything about, right? And so maybe I couldn't understand how stressful that might have been to say like, hey, I want to do it this way, and then have people kind of push back on that. But in this case, I was in an area where I didn't know what was going on, and I was out of my depth, and I knew that. So I'm like, I don't know how to navigate this, because I don't know if what I'm asking for is unreasonable or not. And I don't know how to give a justification or an argument for why I want it this way. Like I'm trying to do that, but I also don't know how reasonable my argument is or how unreasonable it is. And so it was really a trip because I was in this place where I'm like, yeah, this is probably how my clients feel. Like they don't realize that like not wanting their water broken at 3 centimeters is not an unreasonable ask, but how did they know? That was kind of an interesting experience. I'm glad that I had that experience, but it really did bring me down. I cried every day because of it. And it was actually interesting because I had met a lot of the different nurses on labor and delivery. They all cycled through antepartum, which is that place where they keep people who are pregnant for whatever reason that need to be inpatient. And there was one nurse out of all of the ones that I had been taken care of by that actually helped that emotional state that I was in so much. And I'll never forget her. She was the only one that came into the room and told me that I wasn't being unreasonable and that I get to decide how this goes, and gave me advice and just made me feel normal. And it totally changed my world because I went from being just almost like depressed. Like I didn't want my babies to be born that early, but at the same time I felt like I was putting them in danger and I felt like I had to fight. And just this one person made such a huge difference. I took that lesson to be like, I'm going to be that person when I, become a midwife and all of that, because that really, like, it saved me in that moment. And it ended up not even mattering at the end of the day, because when they diagnosed me with twin-to-twin transfusion, it was 34 weeks. So a week before they even wanted me. And part of me is like, did they diagnose me with this to get me to have these babies early? I don't know, maybe, who knows? But I ended up having them at 34 and 5. So right around the time they wanted me to have them, because I just didn't want to take the chance of staying pregnant if, my baby was not growing right. So, and now looking back on it with the knowledge that I have after having completed a midwifery program and, just getting to that higher level, like what I was asking for was not unreasonable. I was not. It was something where, yeah, is there a slightly higher risk that I might go into preterm labor if I stay pregnant for one more week? But that was not that high of a risk. And even if I did go into labor, it doesn't mean that my water would have broke. It doesn't mean that my water would have broke at that specific spot where that blood vessel would have burst or something. And even had that happen, I was right next door to the OR, which was the reason I was in the hospital in the first place. So what I was asking for was not that crazy, but at the time it made me feel that way. And I remember the conversations that I was having every day, like they sounded very nice, and it sounded like, okay, we're going to support that you want this, but I want to make sure you understand the risks and the benefits and blah, blah, blah. Right. It sounded really nice. And so I think it's definitely a takeaway for me of like, you can still manipulate a situation or, like stress somebody out, like change somebody's decision just by like having the conversation too often and just not putting yourself in the place of that patient. Like they were having this conversation with me every day, and so it doesn't matter how nice it was. I knew the risks. I knew it already, and they weren't taking that into account. And I remember telling them that I'm like, I already know. I already understand, and this is what I want. Stop making me explain it. I knew that a C-section was going to be pretty brutal, and it was really a bummer too, because when I told you when I first found out about the twins, I thought I'm going to end up having a C-section, and I spent the rest of my pregnancy until I was diagnosed with a vasa previa hunting down any possible way to have a vaginal birth, and I literally went so far as to I was driving over an hour to get to a specific physician who I knew delivered breech babies, not just twin breech babies, but breech babies in general. Because I know sometimes twins, the second baby, even if the first baby is lined up for like a cephalic, head first delivery, that the second baby might come out breech. And so I wanted somebody who knew what they were doing and who wasn't going to, get spooked by that. And so, yeah, I was driving over an hour to see this physician so that I could have a chance at a vaginal birth. And then the vasa previa totally eliminated that possibility. Can't have a baby through their own blood vessel. They break it as they were trying to come through. So I had already kind of wrapped my mind around the C-section a little bit, but at the same time, I was also having them check to see if that blood vessel had moved every chance they would allow me to, because I was hoping. But yeah, that blood vessel stayed exactly where it was. And I had them check like literally the day before the C-section when they diagnosed the twin-to-twin transfusion. So yeah, I think I was still holding out a little bit of hope that maybe I wouldn't have to have a C-section. In my mind, I didn't want to be stuck having a C-section for every subsequent baby. That was a big thing for me. I wanted to experience a vaginal birth. I'm about to be a midwife. Like, I don't want to have never experienced that. That would have absolutely broken my heart. So I'm like, it's not a good start starting off with my first pregnancy being a C-section. And I wasn't excited about the scar either, but ended up being, I don't even care about that anymore. It healed really nicely, actually. But the other part of it too is that cesareans are very brutal. So when we went back into the OR, I did have a little bit of a panic attack on the operating table because, I mean, as they started touching and doing things, like, you can't feel sharp pain, but you can feel pressure and all of that. And I knew how brutal C-sections were. So, like, I remember when they got to the part where they were about to rip my abs apart, I started having a meltdown and like freaking out. And also, my anesthesiologist ended up not giving me quite enough medication, pain medication in my spinal. And I remember it was funny. I was sitting on the table. He did the spinal. He gave the medication, and he was pulling it out. And as he was doing that, I'm pretty sure he was a resident, because he had a preceptor of some kind who was there and chimed in and said, "You did consider her height, right? Like, her height, she's 6'1". So how much medication did you give her?" And I remember the anesthesiologist being like, the resident being like, "It's going to be fine. I gave her enough." But it did not sound confident. And so, but it was already out. And I'm part of me was like, I thought to myself, I'm like, I'm pretty sure he was going to say that either way, because that needle was already out and he didn't want to have to do it over again, which he should have did it over again, because it ended up not being enough. I went through most of the surgery fine. It was after. But anyways, yeah, they got to the part where they were about to rip my abs open, and I literally was I was having a panic attack. And the anesthesiologist, I remember him saying, he was like, "Well, I can put you under to like take away the anxiety, or I can give you," I can't remember which medication he offered to give me, but he's like, "If I do either of those things, you probably will forget the birth of your kids, your babies." And I was like, okay, well, I'm not going to do that. I'm not going to forget my very first birth. And, like, I wouldn't be able to tell this story to you. Right. So I was freaking out, but everything was, I guess, somewhat okay. And they, cause when you can know what's going on the other side of the curtain, like, I was not doing well. They took my first baby out, and, apparently he did fairly well. Now, the second baby, they were having a hard time getting to, because my uterus was starting to sort of contract, and it sort of clamped down on him, and they couldn't seem to like get him out. And what happens when you have twins that share a placenta and a blood supply and all of that is, once one is out and the cord is cut, the blood supply shifts and things are happening there that can cause a lot of cardiovascular stress on the second baby. And that's part of the reason why, when you lose one baby, in this scenario via stillbirth or something like that, that the second baby isn't likely, or isn't suspected to survive more than maybe 24 hours or so. And also, they've cut into the uterus, so they've disrupted the uterine blood supply too. So after they've taken this baby out, they can't get to the second baby, and time is of the essence. They decide, so the doctor decides, he asks for something called nitro, which is going to relax the uterine muscle to let the baby come out. He asks for that from the anesthesiologist. At the same time, he makes the executive decision to extend my uterine incision by creating what's called a T incision, which is the worst type of extension you could give somebody who wants a VBAC one day, because it's the most weak type of incision. It's the most weak, healing, thing. So he does that at the same time that the anesthesiologist, it clicks for him to give nitro. And they should not have done both at the same time, but they weren't communicating super well, I guess. And that ended up causing a hemorrhage. But they did get the baby out from doing all of that. So that's good. And he struggled a little bit, but he perked up after a little while. But yeah, after they started stitching everything back up, they got halfway through that process before they had to open everything back up to essentially pull my uterus back out and try to get it to stop hemorrhaging, essentially. And at that point in time, the medication was starting to wear off, and it was the most painful thing ever. And I remember just like, I mean, I was just like, I felt like I was going out of body because of how much pain there was. And my eyes, I know my eyes were like wide as a deer's in headlights or whatever. I was like, just not, it was awful. It was so terrible. And I was telling the anesthesiologist, and you know how they do the thing where they're like, oh, it's not pain, it's just pressure. But like, I think he realized with how I was acting that like, eventually he was like, oh yeah. And he felt bad. I could tell that he felt bad. And he was like, I can put you under, I can give you something. But then I was like, but you told me that if I do that I'll forget like my baby's first cry, like forget this whole experience. And so, I said no. And yeah, it was just awful. Finally, they finished stitching me back up. And I got a little bit of time to do skin to skin, but I was not really in the headspace for it. And I remember they cleaned me up, and they were transferring me to a new bed to wheel me off to triage, or not triage, but like post-op or whatever. And I lifted my butt up to like climb over into the other bed, and everyone in the room like freaked out because they were like, I remember the physicians that had just finished the surgery were like, oh my gosh, like you're not supposed to be able to do that. But it all ended up okay. They wheeled me back to the room, but I was in a lot of pain, so they gave me Dilaudid. That was a wild ride. And I was like so high off my mind that I remember my babies, they were brought to the NICU, so I was separated from them for a little while, and I, being like high off of Dilaudid, was like, I need to get every ounce of colostrum out of my boobs right now. And so I was like aggressively expressing colostrum to the point where I had bruises all over my breasts from that. But I couldn't tell what I was doing because I was just like, woo, and I couldn't feel any pain. So, but I got a lot of colostrum out. And I remember being so frustrated because I gave the colostrum to the nurse who gave it to the NICU to feed my babies. And like 2 hours later, it was like, no joke, it was probably like 3 days worth of colostrum. I mean, it was a lot. And they called, the NICU called like 2 hours later and was like, we gave all the colostrum to the babies, we need some more. And I was just like, are you kidding me? Like, I'm not going to be able to make any more for a little while because I gave you like 3 days worth of colostrum. And yeah, that kind of was like a big, like a summary of what that whole NICU experience was like. They really made it hard to breastfeed my babies over there. They want them to grow, and they feed them a lot of donor milk, and they tried to discourage me from actually feeding them at the breast because it takes too much energy for the babies to, pull the milk out, they would say. I tried to do SNS feeding. They didn't even know what that was. And so, but on the emotional side of things for me, I was heartbroken about having to have my baby so early. I wanted to give them the best start. And, like I said, I'd always wanted to be a mom since I was really little. So one of the things that was really important to me was just like to give my kids like the best chance in life, like to give them the best start. I took the best prenatals. I ate really healthy. I did all the things right. And still I couldn't keep them in till full term. And that was going to impact them negatively. And then now I'm trying to breastfeed, and the NICU was not giving me really any support. They weren't giving me any support. They were actually intentionally, it seemed like, trying to sabotage that for me. It does feel like you're not able to give your kids anything, when you could. It's like I do think a lot of moms that have their kids preterm for whatever reason probably feel like they failed their kids, like failed their baby. I should have been able to, take care of you. And now you're having to take care of yourself. Your organs are having to do things they weren't ready to do. And so the one thing I wanted to give them was breast milk. I mean, that's the one thing I'm like, well, this is one advantage, you could call it that or whatever, that I can still provide. And it was frustrating because like SNS, for example, a little tube on the nipple where you're giving that extra, milk and stuff like that. Like they were worried about the babies having to use too much energy and, oh, their cheeks aren't strong enough or whatever. And it's like, okay, then they don't have to be strong. If they can latch and I can put a little tube and I can just give them a whole bunch of extra milk, I can at least teach them that this is where you get milk from. And then when they're strong enough, and then they'll still have the ability to. But what they would do too is because they had donor milk. So I would pump and put the milk in the fridge, and then they would use donor milk, and then they'd add, formula to my milk and make it more calorie, so they were getting lots of calories into the babies. But instead of waiting for me to come to the NICU, because I was over in labor and delivery and then I had to stay in like a hotel nearby, instead of waiting for me to get there for the next feed and like feed the babies on schedule, they would feed them just before I'd get there so that they wouldn't be hungry and willing to feed, even though it's like I was on the same page. Hey, I'll feed them for 2 minutes this way, and then you can feed them the rest of their feed with a bottle. I was there promptly. I mean, you couldn't keep me away. Like, I remember literally like less than, I think, 5 hours after finishing my cesarean, I couldn't even walk, but I forced my husband to go and find me a wheelchair. And, we went over there, and I was heading over to the NICU, and my nurses were like, you need to like lay down and stop heading over there. But regardless, it was like they made it so difficult. And there was a lot of like judgment too. I started my business like around that time too. So they judged me a lot for like, being on my computer while I was in the NICU. It was just such a weird environment. And I was like, I really expected it to be more like labor and delivery, what I'm familiar with, where we hold mom and baby in the same regard, and like we care for mom's health and we care for baby's health. But in the NICU, at least that NICU, it really felt like the only thing that mattered was the baby's gaining weight, and not me, not my recovery, or not even the long-term health of the babies. Like I'm talking about like once we get home, I want to know that I can feed them well, and like that they're going to flourish. And yeah, by not letting me at least keep that pathway open to breastfeed, it was really disappointing. Now, I did take them home pretty much not being able to get them latched on anymore. I was trying to latch them on maybe once a day, just to like keep that door open. And I remember going to a lactation consultant probably about 8 weeks after they were born and being like, hey, I've not been feeding them any sustenance this way, but I've like introduced the nipple once a day. And I asked her, I was like, how long do you think I have at this rate to like actually transition to exclusively breastfeeding rather than exclusively pumping, which is what I was doing at that time. And she was like, you probably have about a week before they lose that ability. And so that really got me on a mission to get these babies to eat at the breast exclusively. And oh my gosh, it was like the most difficult thing as a mom that I've ever done. Like it was terrible. I mean, I was having a little bit of a difficult time with postpartum depression, and me and my husband were taking shifts where, he would sleep for 8 hours during the day and I would sleep a broken up 8 hours. So where I would wake up and pump and do all that stuff. But, it was a situation where I would spend a lot of my time awake on my own with these two babies while my husband was sleeping. So I didn't have a lot of like emotional support. And at this point I was trying to feed them and it wasn't working. And I would just cry over it every time I try to feed them and it wasn't working. And I really forced it. And eventually, so slowly, it took months. The lactation consultant made it sound like it would get better after a week or maybe 2 weeks or whatever. It would just get better and better. But it was so slow, I could barely even feel like it was getting better on a daily basis. But eventually, finally, after a lot of work, I was breastfeeding them exclusively. No more pumping. And I breastfed them for over a year and a half. I never fed them formula, which again, formula is not a bad thing, but it was a personal mission of mine to like give them this one thing. And I did it. And I'm like, I was so proud of myself for it. One thing that happened was like, I was living in a camper, right? Some people, again, they know the story where we moved into a camper after I got out of the NICU with them. And one night we had a terrible storm and our power went out in the camper, meaning that I couldn't pump because my pump was a wall hookup pump. And that was crazy because I was like, oh my gosh, like we can't drive because everything was snowed in, don't have like formula. Like, what do I do? What do I do? Like, there's no way to get my babies fed. They needed to eat every 2 hours. They were still very premature, And so I was like, this is like life or death, And I found a way to get them the milk that they needed from the breast long before I had established that exclusive breastfeeding. This was weeks before I went and saw that lactation consultant, but I got them through that night and into the day until the power came back on. And so that honestly was probably what I really needed, because when fast forward, when I was ready to like really do it, I just kept remembering that. I'm like, I made it happen that one night. So they can do this. We can do this. Let's, get it together. And yeah, it ended up working out. It really was, though, like a huge, I just felt so like powerful. I think a lot of people feel like so empowered after their birth. And they're like, I did it. Like if they did it the way they wanted to do it, whether it be unmedicated or they postpone their epidural to a certain point or whatever, right? They just feel like on top of the world. I obviously did not feel that way after my birth. I would say my birth was very traumatic. It was awful. But I felt that after I got them to breastfeed. I didn't think that I had postpartum depression at the time, and I never got treated for it. I just remember crying a lot. And I really believed that it was because of the breastfeeding thing, because like I said, it was months of just struggling every day and night with that. And then also I had started my business, and that was incredibly stressful. I mean, like gowns were piled up like everywhere, and we had 2 dogs and we had 2 bassinets, and it was like in a camper. So I attributed all of my depression symptoms to those stressors, but I do wonder if maybe it still would have been there had all of those things, been normal or whatever, because I did struggle with postpartum depression with my other 2 pregnancies, and especially with my most recent one. But yeah, I mean, I just cried a lot. And I never blamed my babies or anything. Like I don't know. I just was in a very dark place. I feel like when I look back on certain times of my life, there's always like a hue to them. Like either it's like a bright, happy hue or a dark hue. And that was one of those times where there was a dark hue to that time. And it is hard to differentiate. I mean, I will say, like, I think I did have clinical like postpartum depression with my first, and I definitely had it with this last pregnancy. My middle one, I had symptoms, but I don't know that it would qualify. I think it could have been more of like a baby blues. And sometimes it is more of like a gray area where it kind of can slowly sort of tip over into postpartum depression. And it's hard to know, like really what it is. Like, but like I said, this last one was like super, super clear. I was like, yeah, I cry 2 times a day, and I don't know why. I just can't get out of bed. And like, so I'm like, this is definitely it. By the time that I was able to exclusively breastfeed, my business was doing better. I was getting ready to move out of the trailer, and I just felt all around better and happy, and, like back to being myself. Like eventually you just start to feel a little bit more like yourself. You start to be able to see the bright side of things, start to look forward to things again. And it can happen kind of slowly, but that's kind of how when that worked out. It was way more complicated. That pregnancy and the birth and the postpartum was like the most complicated out of the 3. So.
All right. Thank you so much for tuning in. That was Caitlyn's birth story with the twins, but she also got into birth stories with her 2 successful VBACs. So if you'd like to hear those, please tune in next week. Those will be our Friday episode coming out next week. So stick around for that if you are interested, and we hope to see you on Friday. All right. Bye-bye.